Hello, and welcome to the Osteoarthritis Action Alliance Lunch and Learn webinar for April 21st, 2021. Thank you for joining us this month. Our presenter today is Nick Turkas, Director of External Affairs at the Arthritis Foundation. As a nonprofit professional for more than 20 years, Nick has successfully designed and managed local, regional, and national programs and services with measurable results. His experience creating physical activity and public education campaigns that involve and reach patients for maximum impact. He currently oversees the Walk with Ease program and manages relationships with national nonprofits, academic institutions, and healthcare professional societies. Nick Turkas earned a bachelor's degree in public relations and a master's degree in human services management. Today, Nick Turkas will share the importance and results of patient-reported outcomes research in his talk entitled How It Hurts, an update from the Live Yes Insights study. Thank you for being here, Nick.
Thank you for having me. I truly appreciate the opportunity to talk about the Insights survey and the How It Hurts report. This is a landmark study, and really what it does is helps us understand how arthritis affects a person. And for a long time, you mentioned that I've served at the foundation proudly for more than 20 years. I have talked about millions of people being affected by arthritis. And I have talked about the fact that arthritis is the #1 cause of disability for a long time. And those numbers are important. But what this report does is that it digs into that patient experience and provides in a quantifiable way how it hurts, how arthritis pain affects a person's life from the minute they wake up to the point where they go to bed at night, and how awful that night can be for many people. So I'm really excited to share the information here. And it's also important to know that this is a teaser. This is not the full report. You'll see the cover of the report on this slide. The full report will be available May 3rd, and that we'll have a campaign to provide the full report to all of the organizations that are represented on this call and throughout the Arthritis Foundation's reach. And we really would love your help sharing this report, and we hope that this report helps you and your organization do the great work that it does to help people with arthritis. So let's talk about insights. What is the survey? Live Yes Insights is one of many ways that the Arthritis Foundation is listening to top patient needs and concerns and responding with data-driven agenda that addresses the challenges patients face in every aspect of their lives. There are two studies included in the Insights program. One is focused on adults with doctor-diagnosed arthritis, and the other is for children living with arthritis. And both studies look at 3 domains that we'll talk about: physical health, mental health, and experience of care. And this survey started in 2018. As of the end of 2020, we had more, almost 40,000 surveys in our adult domain. And that second arm came on for children last year. And this survey is an update of the report that we did last year. For folks that really want to dig into the data, where the questions come from in our report, they come from the Promise 29, Promise Emotional Support Short Form version 2, and the Healthcare Empowerment Questionnaire. We also work with Dartmouth College to help us create and review the results of the survey. So you can look at this sort of development of how the survey was put together using more than 110 subject matter experts. And again, Dartmouth University helped us, and patients helped us come up with this methodology. And also we published the methodology in the ACR's journal. So the report looks at 3 domains of health: physical health, and that's how people physically function, their ability to sleep, to move without fatigue. emotional health. And emotional health, I think more and more people realize that pain affects emotional and social health, but now we're able to capture it in numbers, and the numbers are staggering and upsetting, to be quite frank. And also the ability to have a successful relationship with your healthcare provider. And we'll see later in the report that a person's relationship with their healthcare provider really impacts their experience with arthritis. And that relationship is critically important. So we had strong representation across all ages. We had strong representation across the US. We do believe that the survey tool, which takes about 10 minutes to complete, is a good tool because most people that start the tool, and this is currently accessed online, do complete the survey, and we are able to have a unique identifier for most of the people that complete the survey. So we've got good data. The report will include several pie charts, and I will showcase some pie charts today. And just to give you a little primer on how to review them, the pie charts will be broken into various sections, which will show either the within normal limits, so that's the population without arthritis, and then the type of impairment that arthritis affects a person with. And so you can sort of see where people with arthritis are with their pain or with their emotional issues compared to the general population. So what have we learned? So pain is the biggest issue for people with arthritis, and that should not be surprising. But even for a veteran like myself in the arthritis community, it still shocks me how significantly arthritis pain affects people with arthritis. So, and on a 1 to 10 scale, average pain is more than 5. So this is pain that can't be ignored. It is an interruption in your life. So, and then we've got 66% report pain level of 5 or higher, indicating moderately strong pain approaching distress. So, just think how having this pain, which interrupts your daily activities, how that impacts your ability to take care of yourself, complete your work, take care of your family. It has a major effect, and it's something that's happening all the time. 100% of these people said that they're experiencing, pain they can't ignore, every week, right? It's happening throughout the whole week that they're reminded about their arthritis. And there is a subset of people with arthritis, this 15%, that have 8 or higher. This is severe pain. This is the type of pain that will, that people need to go to the emergency room because they're in so much pain. So it's really important to know that pain is ever present, and that this pain is, for many people, something that they just can't ignore, and even to the point that they need immediate medical care. So looking at how pain affects their daily life and their social participation, I'll give you a moment just to sort of look at these graphs. And only 13% of people with arthritis say that pain doesn't really affect their daily activities. So the other 87% have impairment, right? Whether it's mild to severe. So this is a major problem. 75% reported that pain interfered somewhat or quite a bit or very much with their day-to-day activities. 66 reported that pain interfered somewhat, quite a bit, or very much with their ability to participate in social activities. So just being able to manage your day-to-day, get dressed, feed yourself, toileting, showering, all of these things that we take for granted, arthritis has an impact on. And then your social participation, which does have an impact on your mental health. 74% reported that pain kept them away from doing activities with their family. that's significant. This is the kind of pain that causes people to lose relationships with those that they love very much, and that is extremely distressing. We 9 out of 10 patients experience pain that is an interruption in their daily lives, and 2 out of 3 in their social activities. So it's just really important to call this out. So when we think of the type of, the work that we do, it's important to note, yes, that they have pain, but also how does this pain affect them? And so putting yourselves in the shoes of a person with arthritis and just really understanding how this is something that they just cannot ignore. Some more stats on their ability for physical function. So 62% reported that they either could not or had difficulty go up and down stairs at a normal pace. So I have answered phones for people calling into the Arthritis Foundation for many years. And one complaint that I have heard many, many times is that people who live in, a 2-story home will not be able to go up and down from their bedroom to their main quarters because stairs are such an issue. We have people that need to move because their home is not functional for them. And this is the data that bears this out, right? So just where people live could be impacted by their arthritis because of the way that their home is set up. 49% said they could not walk at least 15 minutes. What if your bus stop is a 15-minute walk away? What if your, 15 minutes is probably a trip through the grocery store or through the mall? Your inability to shop for yourself. The inability to get around in your home, get around in public spaces, to be able to move with independence through your community and your neighborhood, arthritis affects it. So 8 out of 10 arthritis patients experience more difficulties in their ability to function physically than the general population. So this is something that impacts the overwhelming majority of people with arthritis. So let's take a look at well-being, sleep and fatigue. We previewed some of this data last year in the survey report, and I remember being, I was surprised how much sleep was affected by arthritis. But we do have, I could tell you anecdotally, I've heard from patients that have to sleep in a chair because they can't sleep comfortably in a bed. Or it's, having sleepless nights will lead to more pain, and more pain can cause mental distress. And so there is a real cycle here with this sleep quality and fatigue. And so when you don't sleep very well, you're tired throughout the day. So all of these things sort of stack up against a person with arthritis. And we can see it here in the data. 5 out of 10 patients experience pain that impedes their ability to sleep. So if you have arthritis, you've just got, it's a coin flip whether you're going to get a good sleep or not for many patients, and that their fatigue is a major problem. And so we need to talk about solutions for pain, but we also need to talk about solutions for fatigue. So more and more, the public health community is very aware that different people with different backgrounds, demographic backgrounds, have a very different lived experience with pain, disability, and health outcomes. And arthritis is no different. Those that have a lower income levels or lower education levels, not surprisingly, have higher levels of pain interference, lower levels of physical function, and a lower level of participate in social roles. And so there is an injustice that happens for people living with arthritis, much like many other health outcomes. But this is true across both osteoarthritis and inflammatory arthritis. And so social determinants of health have a major impact on arthritis, and the data bears that out. It's also really important to know how important a person with arthritis's relationship with their healthcare professional. So HCP is healthcare professional. So, those folks that have a good relationship with their healthcare provider, they have lower pain. And if you have a negative relationship with your provider, you have more pain. And there are probably many reasons and many theories why people have good or negative experiences with their healthcare provider. Right now, we just want to share that healthcare provider relationships and patients' agency within those relationships most definitely affects their pain scores. So again, this is sort of a preview of the report. The report has a lot more detail, and it has a lot more information about all three of those domains. Again, we're releasing the report, the full report, May 3rd, and we're really excited to sort of share this data with you. But data alone doesn't change anything for people with arthritis. This report is a call to action. This report is the data that we need to create better programming for people with arthritis, to create better policy for people with arthritis, to create better research that will impact people living with arthritis. And so the data is great, but now we need to do something with it because now that we know, we need to do. So we're launching a 3-year initiative on pain. And again, we're going to be investing in research. We're going to be investing in funding for public health, and we're going to be creating stronger connections across the community. So part of this launch in May with our How It Hurts report will also be part of a 3-year pain initiative, where we're going to be taking on special projects using this data to positively impact the lives of people with arthritis. And one of the first things that we'll do is launch a new app that will help people manage their arthritis pain. So the app was a year in the making. The app is called Vim. It will be available in May as well. And we took a lot of time and we took a lot of work to put this together. And there was a lot of patient feedback and there was a lot of data that was reviewed. The new tool will help people with arthritis set goals, and those goals will create opportunities for new content and connections, and it will help by setting those goals, and the accountability will help people with arthritis achieve better health outcomes. We also know in public health that goal setting and social contracting is one of the best ways to improve health. So this is a call to action for everyone on this call to tell folks about our How It Hurts report. We also would like to have you continue to share the insight survey with your patients, members, and other stakeholders. This is an ongoing study. So the data that we're getting now will be used for next year's report. The data that we're getting now will help create new tools and new opportunities to better serve patients. We also know that the data that we have in the survey is good. But, we are always striving to have better representative data from ethnic minorities, low-income individuals, individuals living in rural communities. We need to do a better job of getting those patients involved in our study. And so we actually have a grant opportunity to engage those populations. And so I am managing a grant opportunity for organizations that can help us recruit in those categories. And we'll provide funding to recruit either 500 or 1,000 assessment surveys. And we hope to use that data, but also we want to learn more about how those organizations successfully recruit. So the data is great, but we also want to learn about how the Arthritis Foundation and our staff and volunteers can better message to those communities, speak their language, find the terms and tools that will invigorate those audiences to provide the survey results. We also want to share our Walk with Ease program. We talked about how physical function is very much affected by arthritis. And we know that Walk with Ease, which is an evidence-based program that helps people go from a sedentary lifestyle to walking, through walking, to be able to have reduce their pain and increase their overall physical fitness. And then look out for the launch of our Vim app. We're sort of at the mercy of the Apple Store and the Google Play, but everything is set for it to appear in those app stores on May 15th. So I know I've just shared a ton of data and a lot of information, but I'm excited to answer any questions that you may have.
Great. Nick, that was fantastic. And the presentation, the data, the slides, just a very, very exciting overview of what's to come. I think you've given us a glimpse and piqued our curiosity. And so I'm sure we're all looking forward to that report. Looks like we do have a question already, and I'll just remind the rest of you that you can type any questions for Nick into the chat box. Can you share the link for the grant opportunity as well as the survey? And if you're able to, if there's a URL that I can type into the chat box, I'm happy to do that. And we can also include it in the follow-up email too.
Yes, I would like to share, because there's a couple of documents for the grant opportunity, but yes, let's please include the grant opportunity, which shows exactly how much, how to do it, deadlines, reporting structure. It will be all in there, and I will be available to answer any questions that you have. But you have until June 15th to turn them in, so you have plenty of time.
Okay, great. So we'll include the link to that grant opportunity in the email I send out later.
Perfect.
And the survey as well, you said it's still open. You're still wanting people to participate in the survey. Where is that housed?
arthritis.org/insights.
And is it available in Spanish?
It is. We now have the survey available in Spanish as well.
And do any of the reports from the data you shared today, will that include any responses from Spanish speakers?
No, this report does not include Spanish speakers, but the How It Hurts 2022 will will have it. So we're always building.
That's a great addition. And what if an organization wanted to track their own participants or members? Do you have a way to support that?
Yes, starting this year, we now have the ability to provide organizations or a healthcare provider a unique link that will track their responses. And once an organization or an individual recruits 250 completed assessments, we can provide them with a custom dashboard that will provide the data that they've recruited across those 3 domains and compare it to the national data. So if you're an organization and you're serving a specific population, you will see, hey, am I doing a good job, or where are some deficiencies that we have that we can improve that? And ultimately, the Arthritis Foundation would love to talk to you about maybe some co-creating some solutions on how, or learning from your best practices. And those tools can help us do a better job of serving our mutual stakeholders.
That's a really interesting tool. How would somebody get that set up? Is that through you?
That's through me as well.
Okay.
So please contact me.
Great. And if anyone else has any questions, we have a couple more minutes, so feel free to type those into the chat box. Nick, I was wondering if you could share a little bit about any data you all collected about how COVID has impacted people with arthritis.
Great question. And I'm excited because we actually do have a page in the report which looks at that very data point. So we looked at how the survey responses were coming in March of last year, when things were starting to get really hairy around COVID. There was a lot of anxiety about what COVID would mean. And then we looked at a few months later when it really started to ramp up. And then we look at the data again, almost a year from that point. And not to give everything away, but you can see the assessment scores start to get worse at the height of the initial wave of COVID. And now we see that the scores are starting to normalize again once we have some, brighter days ahead, hopefully. So it's interesting to see how how the pandemic, which is, a virus, but it did very much have an impact on our assessment scores.
And so I was just curious about people who may have taken the survey during that time. Will there be any chance for follow-up data about maybe how things have changed for people who've already taken the survey?
That's something that we can continue to do. And certainly if there are folks that want to dig under the hood when it comes to the data, this is a survey, this is something that we regularly review, and certainly we would be open to researchers or individuals that would have data expertise if they want to help look, under the hood, so to speak, at particular data points. That's certainly something that I could talk to them about.
Great. Well, it does seem like you have, the information you have is just going to be so important for developing resources and for community organizations wanting to meet the needs of their participants. And we thank you so much for giving us a glimpse. It looks like we have one last question here. How are you ensuring that individuals are not responding more than once?
Oh, they are. This is a survey that individuals can fill out more than once. And in fact, we encourage folks to fill out surveys multiple times throughout the year. And so that is something that we are striving for. We want more people to take it, but we also want people to take it more than once.
Great. We don't have any more questions. Nick, was there any last information or anything else you wanted to say before we close out and talk about next month's webinar?
I just really appreciate the opportunity to share this information. And again, please continue to share the insight surveys with your stakeholders. And this is something that is like I said, at least a 3-year initiative moving forward. So this data will keep coming.
Well, Nick, we are so grateful that you are here today. We thank you for this fabulous presentation and the work that you and the Arthritis Foundation are doing. And thank you to everyone who joined us today. That concludes today's presentation. We hope you'll join us for our May Lunch and Learn, which will be on May the 19th, co-hosted by the Osteoarthritis Action Alliance and ORCE's OA Prevention SEPA group. The May Lunch and Learn will feature a pre-recorded presentation by June Kennedy, PT, DPT, and Grant Garriggs, who's MD, who will discuss return to sport with glenohumeral arthritis. And that session will be facilitated live by Garrett Bullock, who's also a PT with the ORCE's OA Prevention SEPA group. And we'll have a live question and answer session at the end. So we hope you can join us. But thank you for being with us today. And that concludes our presentation.